Dr. Fitzgerald, would you like to get us started?
I would. Thank you so very much. Welcome, everyone. It is wonderful to see your faces. This is our beginning of our second year. And we are now, Emily reminded me, in our 13th month of an existence as an organization. It's really pretty amazing, I think, the things that have been accomplished so far. And part of that accomplishment has come from the dedication of deciding that we were going to have a trauma-informed Georgia, and we were going to work together and we were going to learn from each other. And today we are going to have our entire meeting on hearing what you have been doing around the state. The notion is that if we participate in this manner, we'll be able to rapidly progress throughout the state. And of course, that's been made possible by the Patillo Foundation. We are so thankful for their grants and from the board. Lynn, I know you are on this call, and the board really wants to thank you for your generous support and for the progress that you've made possible. The second thing I want to be sure and tell everyone is that Bonnie Hardridge is, who many of you know, is also one of the founding patrons, has just been elected co-chair of Behavioral Health Philanthropic Coalition, which is over 40 foundations that are dedicated to changing behavioral health in the state. So thank you to both of them. So with that, we will have a packed agenda. I want to start with Emily, if you will perhaps do the introductions. We are going to start with Athens, and we're going to hear progress that's being made. Happy holidays to everyone, and I'm so glad to be associated with you all, and I'm so glad you're here today. So Emily, if you will introduce our first speaker.
Yes, ma'am. Thank you so much. And I would like to ask everyone, if you have questions, please add them to the chat. We do have a packed agenda, so I don't foresee us having time to answer questions at the end of the meeting. If we do have a few minutes, of course we will. But if we don't, then please put them in the chat. We'll get those to our presenters, and we will follow up with everyone in our January newsletter with the answers to all of those questions and a meeting recap. So thank you all for being here again, and I hope everyone has a happy holiday season. Our first regional grantee presentation is from Athens, and Sarah McKinnon is the president and CEO of the Athens Area Community Foundation. Sarah?
Good morning. Thank you so much, Emily, and everybody associated with this incredible endeavor across our state. Since I'm the first to go on behalf of all the grantees, I just issue an incredible thank you, and a thank you to all the other grantees, as this has been an extraordinary learning experience for us all, and I look forward to the future. I know we have 10 minutes, so I'm going to get going. I first want to acknowledge that I think the importance of our ability to get up and running with this behavioral health grant were the partnerships already in place in Athens and our region. I would like to introduce, and if you can just wave, my partners, Dr. Grace Bagwell-Adams from the University of Georgia College of Public Health, Erin Barger, who is the project manager for Envision Athens, Meg Bramlett, who is a PhD candidate in the College of Public Health, and Jacob Lambeck, who is a recent MPH grad from the College of Public Health, both from the University of Georgia. You'll see that we have 3 partners on our introductory slide. The Envision Athens program is the foundation for our community and economic development plan here in Athens. And while they're concentrated on the Athens-Clarke County area, many of the multiple partners they convene represent our region. So they were a ready, able, and willing partner in this grant. As well, you'll see the Athens WellBeing Project. That's where Dr. Grace Bagwell-Adams comes in. The Athens WellBeing Project is quite simply an unprecedented data collaboration effort that we have here in Athens that represents a 17-county region. We developed this Athens WellBeing Project years ago to provide meaningful data that leads to informed decision-making, shared understanding of our communities, improvements in service delivery, policy recommendations, you name it. If you all are interested, we have its own website, athenswellbeingproject.org, and it will show you the household level data that we collect every other year, a social mapping atlas, and so much more. And at the cornerstone of all three of these partners is really the University of Georgia and the College of Public Health that has lent an incredible amount of time to this effort, and we thank them very much. And I have to give a special thank you to our project manager for this grant, Jacob Lambeck, who graduated with his MPH in May, and pivoting into the COVID pandemic with this grant, having a recent graduate who was able to help us move along was important. Key to our grant were 5 aims, and I will not go over those in detail because of time, but those aims were developed because of the data that we had at our fingertips from the Athens Wellbeing Project. Those 5 aims looked at the types of training that we would provide to our communities, everything from youth aging out of juvenile services to homeless families, families in transition, supporting evidence-based trainings for our recovery care communities, and lastly, providing a comprehensive community health needs assessment as it relates to this work. Those were all aims developed in a 2019 world, and as we all entered 2020, we saw that we needed to quickly adjust the way that we were going to deliver services. And you'll see that in May of 2020, we got going with one of our very first activities. We provided a Trauma 101 and secondary stress training. What was fascinating about this training was the number of people that we attracted. We ended up having over 470 participants in an online training dedicated at 1, giving us a sense of what is trauma, and 2, as nonprofit providers in our region, how can you identify what secondary stress looks like for those who work in your organizations and those who are served. The key behind this project was Dr. Brian Bride, who's a professor of social work and the director of the School of Social Work at Georgia State University. He's an incredible resource, and I've recommended him to many of you. He has a great deal of teaching interest, and his specialty is really traumatic stress and secondary stress. I should say, before I launched into this, the activities this year really hosted around 6 hosted trainings, 2 opportunities for people to get scholarship training for TBRI, which I'll touch on, and then 1 special project that I'll also touch on. So the Trauma 101, and then a follow-up session, which was in high demand. People wanted to be able to take away the training topics and come back and be able to ask special questions of Dr. Bride. So on June 12th, you'll see that we hosted a special session for everybody involved to come back and just kind of have a coffee and talk, and it was a very dynamic session. Each of these sessions had pre and post evaluations done. That was also key to this work, and we're always happy to share that with anybody. A special relationship that developed out of our convening this 2019-2020 behavioral health grant in Northeast Georgia was the North Georgia Goodwill Services. They had a strong interest in helping onboard many of their employees to the notion of trauma in the workplace. And in August, we brought Dr. Brian Bride back for a Goodwill of North Georgia Trauma 101. The concentrated staff there were Goodwill's Career Services team, and that was a great training. Secondly, we partnered with Goodwill of North Georgia to provide secondary stress training. The goal here was a train the trainer concept for all Goodwill of North Georgia case managers. And it was quite eye-opening from a case management standpoint, what in detail these individuals are working on, trying to improve workforce development in our region, but also help individuals who by and large had significant traumatic experiences as children and as adults. Next up in September, we provided 2 concurrent SBIRT trainings. SBIRT is an acronym for Screening, Brief Intervention, and Referral to Treatment. This is a comprehensive integrated public health approach that uses motivational interviewing techniques for the early identification of an intervention with patients who have patterns of alcohol or drug abuse. We had several partners in this project. Both were online with pre-coursework that had to be done. We were able to provide CEUs to all participants. They were half-day sessions, And we trained over 75 individuals, primarily from recovery care organizations, a large number from our probation offices, social workers, and we also targeted emergency room staff. That was extraordinarily successful. Next up in October, we have a nonprofit, a regional nonprofit here in Athens called Chosen for Life. Chosen for Life is a faith-based nonprofit that provides training and support for adopted and foster care families and their children. They have been extraordinary partners with the DFACS program, helping improve retention of foster families in our region. One of their greatest needs was to help a couple of their staff receive TBRI training, which is typically offered at Texas Christian University, but there was a unique opportunity for that trust-based relational intervention program to be offered out of Restoration Rome. So we provided 2 scholarship opportunities to staff at Chosen for Life to attend those trainings. They have also brought that back for a train the trainer concept. In early 2020, we will see volunteer-led trainings by them for everyone else in their network as well. And then lastly here, before I turn it over to Dr. Grace Bagwell Adams, and please let me know if we're doing poorly on time, Emily, is a brand new nonprofit in Athens. And whenever you say brand new, some people get a little bit of a cringe, but this brand new nonprofit, Juvenile Offenders Advocate, is one that is absolutely needed here in the region. And they're providing mentorship and advocacy for juvenile offenders aged 17 to 24. This is a Black-led organization, both in leadership, staff, interns, and board. And we are very, very proud to provide them some onboarding funding so that the very first cohort of mentors and advocates of these juvenile offenders will be thoroughly and completely trauma trained. So we're looking forward to those activities, plus many more that I'll touch on next. In our next slide, this provided a very, very brief graphic so that you can see from a training standpoint the numbers of people trained in each of those. The bottom of that is a snapshot that shows overwhelming support and post surveys for the work that was happening. I'll call attention to the far right bottom. This is where 46% of pre-surveyed individuals and nonprofits indicated that by and large, only about half had experienced or participated in trauma-informed care trainings. And then the 2 on the left are exit surveys that indicate a very high, a very positive affirmation for the trainings provided. Those are just simple examples. Emily, if you'll take me to the next slide, please, ma'am. Coming up in early 2020, we have signed contracts for youth mental health first aid here in Athens. We'll be running 3 concurrent sessions for youth mental health first aid with Dr. Diane Bells from the USDA and University of Georgia. Next, we're going to be working with the Georgia Nurses Association on their community resiliency model. Bringing them to Athens is 100% due to this grant and introduction there. And then lastly, closing on December 15th is a very comprehensive community behavioral health needs assessment that Dr. Grace Bagwell Adams will now tell you all a little bit about. Grace?
Thank you. Emily, if you could turn to the next slide, that would be great. Good morning, everyone. My name is Grace Bagwell Adams. I'm on faculty in the College of Public Health as an Associate Professor of Health Policy, and I'm also the Assistant Dean for Outreach, Engagement, and Equity. It's been my honor to work on this with our community partners and Resilient Georgia. Just want to express gratitude as well for all of the support and just the community that's been created around this. We have been engaging in community needs assessment work in Athens through the Athens WellBeing Project for the last 5 years. But one of the things that became really clear as we started out working on this particular grant was that we needed more information on the supply side, particularly around behavioral health providers. We had often collected very intentional representative data on the demand side, looking at really what the prevalence and incidence are of some of the conditions that we might really care about: depression, anxiety, substance use disorder, access to health care, all kinds of different measures on that side. But we didn't really have a good grasp in our region about what the real supply was of healthcare services for behavioral health, but also other kinds of support. And so we have embarked on a supply side provider perspective survey that launched at the beginning of November. It will close December 15th. We have over 150 providers that have responded from the area. We are incentivizing their participation with the Starbucks gift card, and we have really found that our providers are giving us all kinds of really important information. We originally had designed this to ask just generally about their provision. When COVID-19 hit, we pivoted and designed a special instrument that really helped collect data about the pre, during, and then post sort of perspectives of providing services amid and then after a global pandemic. And so those data are really going to augment what we're already looking at the national and state level, which is very significant, startling increases in opioid overdoses, drug overdoses more generally, issues with suicide, increases in incidents of anxiety and depression. And we're seeing all of that reflected in our data. Just a quick highlight of some of the things that we're seeing our own providers regionally struggle with. One of the biggest things is our local providers, especially smaller organizations, being able to get the personal protective equipment, the PPE they need, cleaning supplies for their own organizations to make sure they can safely provide services to clients, and also having the resources to pivot effectively to telehealth provision, which is a really big piece of being able to continue care, especially for those who are already diagnosed and in care. So that's one of the big challenges. I think our organizations are also, in the preliminary data, we're seeing them struggle with their burnout. The staff are tired, and I think that that's something that we can be really strategic about in terms of thinking about our next steps with this grant and how to support, back to the point around secondary trauma and what Brian Bride has taught us, how to support really the service providers who are on the front lines and serving the families in our communities who are struggling with behavioral health. And then finally, just seeing the same trends increase across all providers. They're really just saying that they're seeing a really a new level of individuals who have demand for services, and at the same time, individuals who need services have lost jobs or lost health insurance and are really financially constrained. So what we're learning from this is going to be really critical in terms of informing next steps. I look forward to sharing the full findings by the end of January, beginning of February. We're going to marry the supply side data with the data we already have from our healthcare systems, from the Department of Public Health, and that we've collected on the ground from Athens WellBeing Project. So thank you, Sarah, for sharing. Emily, thank you. I'm sorry you ran over just a little bit, but I, again, just want to express gratitude for the work and let you all know that we really look forward to sharing this robust data when we have closed the survey and done the analysis in the winter, early next year. Thank you.
Thank you, Dr. Adams. Emily, thank you so much.
Thank you both. And again, please continue the questions in the chat. I'm sorry about the blue arrows on the presentation. I don't know where they came from. They were not there this morning, so those aren't supposed to be there. Apologies to everyone. Next, we have Dr. Kim Loomer. She's the Associate Dean and an Associate Professor for Psychiatry and Health Behavior at the Medical College of Georgia. Kim?
Sure. Good morning. Thank you, everyone. I feel like I'm with my people this morning, so that's good. I love seeing this work, and we're happy to be here to present the progress we've made so far. And we have a lot of gratitude for the Potilik Foundation and Resilient Georgia. So with that, we can go to the next slide. So we decided in looking at our community data that we wanted to address teens. So 13 to 19, we wanted to look at ACEs, trauma-informed care and resilience. And we looked at what partnerships currently exist and what we needed to build. So in this case, we had a few of the partners, but mostly we were building a new sort of organization to look at trauma-informed care in the Augusta area. What we ended up doing was partnering with 8 community organizations, and then we've got 9 different departments and colleges at AU and the Medical College of Georgia involved in our project. And we piloted this program in the spring with teens. And as all of you know, that's when COVID struck. So we weren't planning to pilot it, but it seemed like the right thing to do. And so we did that, and we're currently doing an 8-week resilient teen training. We go to the next slide. I'm going to have Julie Miller, she's from Family Connection, she's our partner, to talk a little bit about the lessons learned in the pilot program, and then I'll kind of finish this up. Go ahead, Julie.
Good morning, everyone. Thank you for allowing me to be here. I'm really excited about the opportunity. So you all know that what happened in March, schools shut down, and we had planned to roll this program out in every county that we were in, which is 14 counties. And we were going to do it in either a club setting or an after-school setting. And of course, that became we were not able to do that. So we had to completely rethink everything and try to figure out how we were going to reach these young people that with this program. So what we did was Kim and I talked about, well, how can this work? And she imagined something that I think is going to be something that we can all benefit from. And that is we use the medical students at AU as our facilitators for this program. And we created a whole new program because we could not get the training that we needed on one of the program that we had chosen to use. And these young people, these medical students, have been an amazing in the work that they have done and the innovation that they have brought to this and the connections that they have made with the teens. So that has been a remarkable achievement as far as I can tell. We did learn some lessons in our original pilot program. And that was internet connectivity is a real problem for many of our teams. And so we had to, a lot of them did have phones. So we ended up getting them either phone minutes, or we tried to help them or get a Wi-Fi hotspot that they could use. And so that was a huge, with the grant funding, that helped us tremendously. Can we go to the next slide, please? Okay, so we've talked a little bit about our partners. So I am the Family Connection Coordinator in Region 7, which is the Augusta area. And it's, we have 14 counties. And so we started with our Family Connection coordinators, those counties, but now we have engaged many of the partners that you see on this list in the Resilient Teen Program, and we're looking to expand it even more. Can we go to the next one, please? Okay, so the pilot project was just with 20 teens, and that was over a 6-week period. And we focused on ACEs and resiliency skills and stress management. And we learned a lot of lessons from that about what kids like, what they don't like, what teens like and what they don't like, what they're willing to do and what they're not willing to do. So we took all of that knowledge. So we have an evaluator that's working with us, and we did weekly surveys with the students to make sure that we were getting real-time information from the students and the facilitators about what went well, what didn't work, what we needed to do better on. And we compiled a whole lot of data as a result of that, that we're going to be able to use to expand this program and hopefully make it the very best it can be. Can we go to the next one too, please? Okay, so in this next, in the next iteration of this program, the last 8 weeks, we just completed last night. We had 65 teens that stuck with us through this entire 8 weeks. And they logged on every Wednesday night at 5 o'clock and stayed on till around 6:30. And the way that this worked was we did like a 20-minute lesson on the 5 different areas of resiliency. And the coordinators from our medical school coordinators delivered that lesson. And then they broke into small groups that were designed by age. And because we know a 13-year-old is very different from an 18-year-old and what they're interested in and what they want to talk about. So we had 2 medical school facilitators for each small group, which was about 7 students. and they have built a remarkable rapport and a remarkable relationship. So much so that more than half of the students that participated this semester want to return for the new program in the spring. And 18 of our 22 facilitators want to return to do it again. So that tells us we're doing something right. Many of the students told us that this was the one thing that was getting them through the week, that they looked forward to being able to have that kind of communication and someone to talk to that they knew was in their corner. And it has made a tremendous difference for them. And we are extremely grateful that we've been able to provide that for these teens during this stressful time. Next slide, please. So this is the curriculum that we created based on evidence-based programs and services, or evidence-based models. And the 5 pillars of resilience are self-awareness, mindfulness, self-care, positive relationships, and purpose. And so those 5 things were the lessons that we designed for these students, and then very interactive activities based on their age and their cognitive levels. And then let's go to the next one. Oh, I'm going to turn this back over to Kim to talk about our accomplishments. But I just want you to know that this particular, innovation comes from strange places, right? When you have to do something that you had never planned to do. And this medical school model, we believe we're going to be able to write it out and have basically a program that can be replicated and sustained in other places when we're finished with this. And we feel that it's going to be something that other people can implement, and that it can be spread all over. And I just want to say thank you for that opportunity, because it has been something that has really given me a great deal of excitement about work and about how our youth are going to progress in the years ahead. So I'm going to turn it back over to Kim.
Thank you, Julie. That was great. We, as most of the other projects have done, we went through a branding and marketing campaign. And so you can check out our website, resilientteens.org, and it highlights our partnerships, but also we have met with, pre-COVID, we had 3 in-person meetings with our team. And as Julie indicated, we piloted the program during COVID using medical student facilitators, learned a lot. And then we completed last night the 8-week training for 65 teens. We have 4 medical student facilitators and 22 small group facilitators. So it's been really robust, very exciting. And if we go to the next slide, I'll tell you what we're going to do next. We are planning for our Trauma-Informed Care Summit. We are hoping for April, but we may push that back with hoping for vaccinations for everyone and getting to do something in person. We are going to do, as Julie indicated, the 3rd cohort of teens in February, and we're forming an alumni group. The students want to still connect. They want to still be part of this project, even if it's in a little bit different way. And then we want to get back to our original goals and aims, which were to do partner training and engage those partners in a more meaningful way than just having them send teens to us. So those are that's our progress, and those are our next steps. And again, thank you. We've had a wonderful time putting this in our communities.
Thank you, Kim and Julie. Next, we are going to be hearing from Coastal Georgia and Savannah with Lizanne Roberts, who's the Executive Director of the Coastal Georgia Indicators Coalition. Lizanne?
Thank you, Emily, and thank you, Resilient Georgia and the Patulik Foundation, for this opportunity that we had this year to engage our partners and further the Resilient Georgia's platform in our community. We had 4 kind of lead partners. The coalition that I'm a part of has over 100 partners that come to the table pretty much every month in different ways. And just much like Athens, we were easily able to engage partners within our community and get moving quickly. That said, they were the Chatham Safety Net Planning Council, Gateway Behavioral Service Board, and Loop It Up Savannah were our team. And our primary partners were Bryan County
Like
Public
the week
Schools
of the 25th.
and Chatham County Government
Yeah.
Center, which is a serving organization, Effingham County School, Georgia Southern University Department of Education, Parent University, which is a parent serving organization in our community that's been around over 20 years, and then the Savannah Chatham Public School System. Next slide, Emily. So we had a great opportunity through the Planning Council, who had moved the suicide prevention and mindful self-compassion work forward in our community. And so we were able to leverage those resources to reach over 8,000 participants in our community. Primarily, many of those, I think around 5,000 of those were from the Savannah Chatham Public School System. And Vera, who is on the call as well, that you'll be hearing from later in the meeting, is the brainchild behind that. And she's just been able to leverage those resources, not only for Chatham, but also for Bryan and Effingham counties. And so we also partnered with Deep Center, and we're able to engage high school juniors in the first mental health symposium, and then continued to work with the students after the pandemic hit in the development of a podcast called Teenish, which is entirely youth-led and addresses mental health topics that the youth have identified as important. And so we've just released the second podcast of that, and that's available on YouTube. Loop It Up Savannah and CGIC had planned to have mindfulness zones in several schools. We were able to do 2 of those. And then we adapted that to include stress boxes and mindfulness zone activity kits for youth and families through the Front Porch, a youth diversion program, and the Savannah Chatham Public School System to over 500 families, where there is a curriculum with videos and activities that are a part of the 21st century schools that are in our community. With Gateway, the Planning Council, CGIC, the organization I'm a part of, and Chatham County, we partnered to hold the annual mental health symposium that was held over a 5-week period of time, all virtual. There were over 575 people who participated in those virtual sessions. The topics included from empathy.
Lizanne, you are muted.
Thank you. Wellness and resiliency for community and first responders, trauma drama, and opportunities to increase access to services. CGIC also partnered with Georgia Southern and the school system to plan and host the first TIES Symposium. And TIES stands for Trauma Informed Education Symposium, where there were over 100 counselors and teachers from the school system who participated in that symposium. We also held the Trauma 101 and secondary stress classes. Over 175 members of our community participated in those. We directly worked with the juvenile court staff, the front porch, and CASA, court-appointed special advocates, to make sure that they received the Trauma 101 and secondary stress training through Georgia State University Child Welfare Collaborative. Next slide. Some of the lessons that we learned was that by creating a varied menu of training options, this was very important for accessibility and engagement. So what I would say about that is, after the pandemic happened, we were able to engage with diverse partners in our community, one of those being Parent University. So we were able to reach a lot of parents within the community by adapting some of the training so it could be held virtually online and reach diverse populations of people who needed the resources the most. And by involving those non-traditional partners, it helped us reach additional populations within the community and run some new and more creative projects and events. Next slide. So our next steps are, we are working with multiple partners to design our next year. And we want to focus on being trauma responsive and trauma sensitive practices that would be inside schools. So one of the schools that we're focusing on is a school that we call the Land of the Little People. It's the pre-K and K classrooms, and there are over 400 children that are under the age of 6, and 2 EOA classrooms that are in that facility. So we're focusing our efforts in that area to bring trauma responsive and trauma sensitive practices, including coaching for teachers in that area. We want to increase the trainer opportunities in our rural communities to include the counties along the coast, but also southern Georgia as well, and offer those so that we have more sustainability within those communities, so that we can create a community of practice. And the third thing is to complete the training and integration of Handle with Care. We have started this with the public school system in Chatham County, and our next step, because of the shutdown and because of the virtual learning, as we start to come back into more of a hybrid model, making sure that teachers and counselors get the appropriate training on the Handle with Care model. And that's my presentation. If anybody has any questions, here's my contact information, and thank you again.
Thank you so much, Lizanne. Next, we have Dr. Andrea Meyer-Stinson. She's the Associate Professor of Psychiatry and Behavioral Sciences and an Associate Professor of Pediatrics at Mercer University School of Medicine. Welcome, Andrea.
Hi, everybody. Can you hear me?
Yes, ma'am.
Great. Okay. I actually started a stopwatch. Just want to reverberate that thank you to Potomac Foundation and Resilient Georgia. This has been an amazing year. Learning from each other and from our community has just been enlightening to us. And I want to acknowledge my co-lead, Jill Vanderhoek, who's here listening. She's the Executive Director of Community Partnership of Bibb County Family Connections. Also, we have 3 other team members who are here or are represented in this work. Doris Cujo, who's a field representative at the Georgia Rural Health Innovation Center. Zachary Mildren, who's a research assistant at the medical school, and Michael Kashatri, who's a summer scholar, and a medical student at Mercer. So our mission is to build a common language and understanding of adversity, trauma, and adverse childhood experiences while also identifying and empowering our community champions. This has been a year of learning and a year of flexibility and adaptability, which is what we teach our families to do, to be resilient. We had a great start. You can go to the next slide. We had an initial coalition meeting that brought in over 75 members of our community from every stakeholder group you could imagine. Middle Georgia really has not had this work before, so we really were starting at the ground level. We came up with the what we call our hexagons of goals here. And what I'm going to do today is go through some of the ways in which we've achieved small objectives within these goals. These goals were created from our coalition itself. Every coalition meeting we have is data driven. We collect data, we analyze that data, and we feed that data back into our next coalition meeting. We've also been through a process of branding ourselves. We have a Facebook page, a web page, and an email address. And my favorite is our logo. We are resilient, Middle Georgia. Next slide. One of the things that happened with us this past year was we learned to grow and learn from the experience of the work that we've done. Initially, we had a huge amount of plans to do in-person awareness building. That could not happen this year. So we had to adapt and change and find other ways to build awareness. We also became aware this last year of truly how important conversations around racial and economic inequality were to our community, and how to point out racism as a part of the traumatic experiences that our community has, which I know many of you have had the similar realizations or focus. So some of the ways in which we shifted and pivoted this last year to build awareness and to inform our community about this work. One was we offered resilience bags. We distributed over 5,000 bags to schools, back to school, child advocacy centers, social service agencies, Head Start, libraries, which are an amazing partner, nonprofits. We saturated those bags into 9 out of our 14 counties, which we were really happy about. We also offered what we call neighbor check-in cards, which are little cards that you can put on your neighbor's door, put on your friend's backpack, whatever you want to do, that just says, hey, I like you, how are you? Let's connect. We handed out over 900 pads of those with 25 notes in each. We also focus our energy on community outreach that happened outdoors, which we could do safely. So we participated in events in Macon and Middle Georgia, as well as an online event sponsored by the Community Foundation of Middle Georgia, which is called On the Table. If you don't know what that event is, I highly recommend you look it up. It's an amazing community-based change implementation of conversations. Pardon me, that's my email buzzing. We also shifted our focus to our media and infographics to build awareness, because we're starting at the ground level. We really felt the need to summarize and share information about ACEs, the pair of ACEs, adverse childhood experiences, as well as adverse community environments. And so our amazing graduate students and medical students worked diligently to create infographics for every county in our grant. And so you can see here, the Community University in Macon-Bibb County is an infographic that we created. And those are all provided on our website. So if people are interested in what's happening in their specific county, they can pull that. And that's from primarily kids count data. We also have partnered with Dr. Wendy Ellis, who's out of the Center for Resilient Communities. I always forget the acronym. School of Public Health at George Washington University, who does amazing work in the pair of ACEs. I highly recommend you all check out her resources. She has amazing free resources to coalitions and groups like ours, who are really trying to reach out and reach under not just the ACEs on the trees of the leaves of the tree, but the soil. because if we don't change the soil, we can't change what's happening in the tree itself. So those are some of the work we've done to inform our communities and build a common language. Next slide, please. We've also been focused, and part of our goals for this last year was to provide as much training as possible. We have learned that training is wonderful and great, and we have provided it in ample different ways to a variety of organizations. At the same time, we've also learned that just training our community isn't going to be enough to change that soil. We have to really embed trainers and embed larger changes in the system of our organizations to see this movement be sustainable over time. So we're really proud of the training, but also that secondary change that we're trying to make here in our community. We had Dr. Ross Green come and train, work with our Bibb County school systems. We had about 300 people in that training. We've partnered with the Georgia Nurses Association to offer 3 months, separate months of the 1 hour and the 3 hour trainings. We've done probably 4 or 5 Connections Matter trainings, and also the Georgia State Secondary Traumatic Stress Training. All of those happened with a variety of stakeholders. We had the school system, the healthcare systems, faith-based organizations. We've really connected well with the public defender's office and the district attorney's office, who are both working with traumatized individuals in that work that they do and experiencing secondary trauma. And also we have, thanks to Tiffany and others at the Child Advocacy Center of Georgia, we've been able to train 7 of our community champions to be trainers of Connections Matter. So what that means is this next year, we'll be able to exponentially train a larger number of people in the Connections Matter Georgia curriculum. Next slide, please. All right, how am I doing with time? I can't tell. 3 of our other hexagons, as I call them, goals, is to build a strong Middle Georgia coalition, to create a network of leaders, and to empower change from within. We had, as we had hoped to have, 4 coalition meetings, 2 online, 2 in person over the last year. Something we did during those coalition meetings that was really important was we collected data and information from the coalition members and then fed it back into our project. One of the things we did at our last member meeting is we discussed the idea of trauma-informed systems. And then we asked them to identify one trauma-informed change that they could have made in their organization in the next month. And then we had our graduate student go back and connect with them to ask about that and how that change happened. This next year, we're really going to focus on the systems framework. We're partnering with Trauma Transformed to discuss how to take our community leaders through a process of really integrating change into their organizations that's sustainable and will stay here after Resilient Middle Georgia does the work that it's doing. We've met with a number of community leaders. We've also gathered about 200 participants, community needs assessment, and really learned a lot from that. It's not as thorough as the one in Athens, but it was just really a basic snapshot of what are the challenges, what are the needs, what's preventing folks from achieving optimal health. One of the things we learned from that is that mental health and family disruption are 2 of the target areas that our community really wants to work on. And about 25% of those surveyed had never heard of ACEs before. So I think we have some work to do, but also we have a good start. Next slide. All right. So much more that we've done and accomplished in 10 minutes is hard to summarize it all because it's just been amazing. Some of the work we plan to do moving forward is, as I said, expand that Connections Matter trainers out into the counties, really focus on our rural counties. Our graduate student, Zach, who's here, is from a rural area of Georgia, and his goal this year is to really engage more coalition members from our rural areas, which have been especially hit hard by COVID-19. We are also organizing a new Community Leaders Summit. We've had a new mayor and a new DA, and just found out who the sheriff is. So in the last year, we didn't know who our leaders were because they were being elected. So this year, we're hoping to really get in touch with them and connect with them. And Dr. Stan Sonu has offered to come back and have that panel discussion. We're also scheduled to offer screenings of the movie Resilience and Paper Tigers, which we bought and had planned to show in big events and didn't do that because of COVID. So we're going to have drive-in screenings. We are partnering with Robins Air Force Base, who's going to offer that to over 200 of its resilience officers. And then also through the Macon Centralplex, which is another large event space in our community. We're going to partner with the Child Abuse Prevention Month group at our local hospital and Child Advocacy Center. We're reordering more resilience bags. And we are in the process of creating a partnership with a small group of schools in our county, 3 elementary schools, a middle school, and a high school, where we're going to pilot some resilience training within the staff, the families, and the kids. If you want to join us, our next Resilient Georgia Coalition meeting is January 26th. It'll be virtual. Thank you. Appreciate the time.
Thank you, Andrea. Next, we're going to move into our round 2 grantees. So those of you that aren't as familiar with our work and with this program, the round 1 grantees that you just heard from, they've been at this work for about a year, and round 2 just got started this summer. So we're very excited to welcome them. First, we'll welcome Columbus and Chattahoochee Valley, and Sydney Hoke is the project coordinator from the Resilient Chattahoochee Valley Child Equity Collaborative.
Leanne, thank you for the introduction. I'm honored to be presenting here today on behalf of the collaborative and to be able to share our hard work being done in Columbus, Georgia, and our surrounding 10 counties that make up the Chattahoochee Valley. The Chattahoochee Valley Child Equity Collaborative is our regional initiative that seeks to build awareness around adversity and increase resiliency in our local communities, while aiming to improve outcomes in life for children ages 0 through 16. The collaborative encompasses 3 equity-based strategies that we're implementing to bring this vision to life. These strategies that I'll expand on shortly consist of the Basics Chattahoochee Valley, Community Schools United, and Resilient Chattahoochee Valley. When we began our work in the community, we quickly wanted to get the community involved. Therefore, we created a committee to attach to our efforts so that they could provide guidance, expertise, and support. In engaging with these committee members and community leaders, we have been allowed to consistently field new opportunities and make strides in our work that'll help our community as a whole build resiliency together. As I move on to highlight the work of each of the strategies in the collaborative, I hope you'll be able to capture these efforts and opportunities that I'm referencing. You can go to the next slide, Emily Ann. The Basics Chattahoochee Valley, again, is the first of the Child Equity Collaborative strategies that I'll be highlighting. This strategy aims to give every child a great start in life by equipping parents and caregivers in our community with 5 free, simple, and evidence-based tools that, despite their tremendous impact, are easy to incorporate into daily life. The Basics has been able to conduct several trainings on these tools and create connections to how they relate to adverse childhood experiences and to trauma. In particular, we have presented this material to over 90 new enrichment services program employees during their pre-service activities, and in another to 70 professionals at the Virtual Children's Mental Health Symposium that was referenced earlier. In addition to these trainings, this strategy is actively being promoted in the healthcare and education sectors in our community, as their touch points with children and families in our community are so vast, and many other partnerships continue to emerge as well. Next slide, please. One partnership that we can highlight is with the Springer Opera House and their Theater for the Very Young program. With this partnership came the opportunity to integrate the 5 basics into the plot of several programs over the course of the next year. The first program was called Deep Blue Sea and had 6 showings. And after each of those showings, we were able to engage and follow up with parents and caregivers and reference it where in the plot the 5 basics were so that they can be incorporated at home. We're eager to continue to grow this initiative in our community and showcase how we can actively set up our children for success through the use of the 5 basics. Next slide, Emily Ann, thank you. In our next strategy, we continue to improve outcomes for children in our community by, again, placing ourselves where the effects of ACEs are not only able to be seen, but curbed with our implementation of Community Schools United. Community Schools United is an evidence-based strategy that focuses on the whole child by allowing students to have access to wraparound support services within the school, and specifics of the strategy are seen on the screen. We've begun to implement these services operating under the guidance of the 4 pillars, which are also on the screen in our first community school, Dorothy Heights Elementary here in Columbus. Next slide, please. The picture on the screen was taken in front of Dorothy Heights Elementary School, which again is that first community school that we have in our area. In the school, as others have mentioned, the COVID-19 pandemic and its emerging needs have really just taken priority and therefore have required for us to respond accordingly. Some of these needs in the school that relate closely again to COVID and our goal of addressing adversity include that many of the students have unstable housing, lack of food and clothing, again, that lack of internet access that we touched on already today. And there is currently a high mobility rate among the student body. Their families at our community school report experiencing job and wage loss and other financial barriers, as well as grief and other mental health challenges. Therefore, with this strategy, we plan to continue to address those needs firstly, and then continue to build resiliency through shared information and community collaboration by staying connected to all pieces of the school puzzle. Next slide, please. As we begin to wrap up our presentation, we've arrived at our final equity-based strategy of the Child Equity Collaborative, Resilient Chattahoochee Valley. This strategy aims to train our community members on topics surrounding adverse childhood experiences, trauma, and resiliency. And an innovative feature of this initiative is the development and launch of an online, on-demand educational platform that is going to provide the opportunity for members of our community to complete trainings that encourage a trauma-informed approach to life. The platform will host training content that targets specific sectors of the community, as well as incorporate local resources, encourage cross-county and sector collaboration, and can also easily manage and track training progress for users. So we find that feature to be really helpful. As Resilient Chattahoochee Valley has been introduced to our community leaders, needs and opportunities to increase the awareness and understanding around ACEs has occurred. And one of these opportunities evolved from collaborating with our partners at Piedmont Columbus Regional. Specifically, we have been able to engage with multiple local pediatricians to date to discuss the opportunity of using this platform to train future providers and nurses in our community on topics that will enable them to become more trauma informed. As Emily Ann goes to the next slide, we'll see a sample training path on the screen that currently exists on the platform that has been created in partnership with Village Creed. We're excited to share future updates on the platform and our training efforts, and again, more insight into our partnerships in the future. Next slide, please. So again, in addition to building out the Resilient Chattahoochee Valley platform with training opportunities and preparing for launch, the collaborative also has the next steps of expanding our outreach and awareness efforts with local hospitals and healthcare providers, as well as escalating a new and exciting partnership with the Pastoral Institute to bring virtual mental wellness sessions that target students and educators in public schools to several of the outlying school districts in our region. I, again, like everyone else, want to thank everyone for allowing us to share our work with you to date, and for all of the support that we've been given along the way on this journey. And I look forward to being able to share more progress with you as we enter the new year.
Thank you, Sydney. Next, we're going to hear from Rome Floyd and Doug Belisle, the Executive Director of the Bartow Collaborative.
Good afternoon, everyone. Can you hear me? All right.
Yes, sir.
Well, I'll just say that I'm inspired by everyone's work so far. It is awesome to be a part of this unique and awesome opportunity. So representing the 15 counties in Northwest Georgia, which is Region 1 for our Georgia Family Connection partnership. And this is a little bit unique. I'm super excited that a lot of you have partnered with Georgia Family Connection. Our Region 1 basically is our Georgia Family Connection coordinators. And so what we've done is we've looked at how we can build a region of resilience through the work that we're doing collaboratively, not only within each county, but collaboratively in our region. You can see that we've developed kind of a three-pronged approach, or three phases of capacity building, community awareness, and then systems change. And really starting with what can we do to build capacity within our region and within our counties. So we've started with each of our coordinators and boards within each county, and kind of what do you know that you don't know, so that we can begin to build capacity within our leadership. So we've done some facilitation trainings and targeted professional development around trauma and poverty issues. And then our next phase is community awareness. We want to make sure that what we know, we spread out into the community, so that our communities are increasingly aware and understand the nuances of poverty and trauma and how they affect our families and children and communities. And then use that to begin to adjust direct service implementation through system change, demonstrating how poverty and trauma competency through the changes that we make to implementation of programs and services and activities and strategy implementation basically can help change our communities and change the systems and how we do things, so that we're not further traumatizing those that we serve. We've done a lot of work coming out of COVID-19 with some of that, and being responsive to trauma that's occurred through food insecurity, and connections matter. This next slide shows our deliverables and kind of where we are. We've got 15 collaborative executive directors or coordinators that we want to have the capacity to facilitate an evidence-based program or training or workshop. We've done an inventory to schedule training opportunities. One of the challenges that we've been presented with is a number of our coordinators would love to go through the Connections Matter Train the Trainer training. And so we're in the process of setting that up through partners and providing capacity building opportunities in those programs, which are not all necessarily super cost effective, or we'll say there's some cost constraints involved. So we're working through, and thanks to the Patulak Foundation for providing grant money to be able to enable us to do a lot of this work. We've sent two persons in the region through TBRI practitioner training. We've got 3 scheduled for AHA process certification, and then 1 is train the trainer for Connections Matter. And we've developed a detailed project work plan where we've got committees that are updating that work plan monthly and working through the process of how do we continue to make sure that we know how to move forward with training and with our deliverables. Next slide shows we've completed evaluation plan and data collection mechanisms so that we know how to report back. With there being 15 plus of us in the region, being able to collect that data and make sure that it's accurate is super important. We wanted a way to be able to collect that, and we're utilizing Google Forms and Docs to collect data monthly so that we can go back and report specific outcomes. Project specific MOUs were signed by all of our county collaboratives so that we know exactly what we've gotten ourselves into and how to move forward. And then we're working towards being able to provide 3 trauma or poverty and focused awareness activities per county, so that moving forward into the next phase of the grant, starting in 2021, we can really begin to move forward with community awareness, which would include these activities as well as civic dinners. Each county is committed to do 3 civic dinners within the grant period, so that we can really involve those in our communities about talking about these issues. We're using the Nurturing Communities module with civic dinners to be able to talk about some of the issues in our communities. And so we're excited about that. We've scheduled 5 viewings of the movie Resilience. We did our first pilot in December and had an awesome outpouring of positive feedback about that. We've got our next one scheduled in January, and through the month of June, we'll have 4 more of those in 2021, which will engage our region in those virtual live screenings. Next slide. We're working to also engage 10 of our partners in project implementation for key partners. So how can we not only through our partnerships through Family Connections, how can we really reach out into the community and develop some regional partners? We've already done a lot of that with Georgia. Oh shoot, the name is escaping me. The GCCA, Georgia Child Advocacy Group, as well as DECAL and other regional partners. 15 of our local and regional partners are going to be engaged in quarterly stakeholder meetings where we identify those key partners and then work forward to engage collaboratively on these issues. And then that works itself out in Family Connection through our annual plans. Each collaborative develops an annual plan, and most of our planning is done about 6 months ahead. So we're getting ready to start work on our fiscal year 22 annual planning. All of our plans include some sort of trauma aware or informed or poverty informed sort of activities and programs. And then we're working on a comprehensive toolkit that we can make available to our region that has a warehouse of resources. So we're collecting those. Next slide.
Now I'm on the what's-a-diggy, y'all.
So next steps, we're working to schedule Connection Matters, train the trainer, additional training and professional development opportunities through our Poverty 101 and Trauma 101 train the trainer, or actually informational trainings that we're working on. Poverty simulations and parent cafes. We're looking at identifying additional training opportunities as well. Community awareness. Next steps, we're supporting our collaboratives in implementing those awareness activities. Remember, each county's committed to do 3 awareness activities, and so we're working towards that, supporting collaboratives in those civic dinners, advertising the resilience screenings, and then coordinating with professional development for our monthly regional meetings. As far as systems change, we're working in participating with the standards of quality for strengthening families trainings. We've already had one of those and plan on continuing that work through that framework, building a catalog of tools, resources, videos, and other support materials, and then planning those agendas and activities for quarterly stakeholder meetings. And thanks so much for allowing us to participate. We're super excited about the work going forward and inspired by all the work that's being done around the state.
Thank you so much, Doug. I appreciate your work, and it's great to hear all the wonderful things you're doing. Next, we're going to hear from from the United Way of Southwest Georgia and Ashley Williams. She's the Special Projects and Administration Manager of United Way of Southwest Georgia. Ashley.
Good afternoon, everyone. Just to echo a lot of other participants, we are appreciative of Resilient Georgia and this opportunity they provided us, to do this work, especially during this time that we have right now. So, especially during the time that it is right now. So, with United Way, we believe that everyone deserves an opportunity to have a good life, a quality education that leads to a stable job, enough income to support a family through retirement, and good health. And that's why at United Way of Southwest Georgia, our work is focused on the building blocks for a good life, education, income, and health. So we titled our initiative the Success for Life Community Initiative. The goal of this initiative is to dramatically improve the health and well-being of our community by addressing the ACEs as a root cause of regional health issues, especially in the light of the COVID-19 pandemic and the patterns of structural racism that we endure in our society. And these are two of the things that are affecting our community the most. So here at United Way, we have over 30 partnerships within our community. Just to highlight a few, Aspire, who's our local CSB, they have multiple staff trained in trauma-informed trainings, and we will be partnering with them to provide a variety of trainings throughout 2021. We're also partnering with the Department of Juvenile Justice and our local Albany Police Department. We are in talks with them to train our local enforcement professionals. LilyPad is also one of our top partnerships. LilyPad is an organization that provides services to victims and families impacted by crimes of sexual assault and child and sexual and physical abuse. The director is trained in Stewards of Children and will be conducting some of our Stewards of Children training in the future. Another partnership I would like to highlight is the Dorothy County School System. We are really excited about this partnership. Right now, it's still a little bit, kind of up in the air because of the school system, because, not knowing whether things will be virtual, they're going through a lot of changes themselves. So we're trying to allow them the space and the time to figure out, how they will be going about, business as usual before we come in and we assist with whatever they need. Oh, you can go to the next slide. So in our geography, so some of the counties that we serve: Baker, Calhoun, Chris, Clay, Doherty, Early, Lee, Mitchell, Quitman, Randolph, Sumter, Terrell, Worth. So you can see, we serve Southwest Georgia. Which is it. So now I'll talk to you guys a little bit about, our journey and what we have in our journey and where we have been so far. We started with some initial meetings with our key partners, such as Aspire and the school system. This was even before receiving the grant. This was during the writing phase when we were writing for the grant. It took a while for us to agree on initial focus or a goal. With everyone had their own ideas, everyone had their own ideas in mind as it relates to their own profession. So, and after finally agreeing on a focus or a goal and receiving the grant, we sent out, notifications, and we scheduled follow-up meetings, and which just also proved not to be the easiest task because everyone had different and busy schedules. After moving past that, we could finally begin working on our training schedules for the upcoming year. But although COVID did impact the training schedule, although COVID does impact the scheduling, because if we do it in person, we must keep it small. If we decide to go virtual, we have to make sure that it has the same impact. And Zoom fatigue is real. It's definitely been a thing that a lot of people have been saying that they've been experiencing towards the end of this year. But we are definitely weighing all our options to decide which training would be best and in which capacity it would be best in. So I just wanted to give you guys a pre-COVID-19 brain break. I want to showcase our youth and some of our partnering agencies with kids just being kids pre-COVID-19. Oftentimes we forget that, with that pandemic, the kids are suffering too. They understand that we're protecting them, but then also, they're missing out on their childhood. And we forget that, this will probably be an ACEs for them in the future, and, may potentially adversely affect them later in life. So. And then another pre-COVID-19 brain break, I wanted to show you guys, just being able to meet in person and just having that open dialogue. A lot of professionals are missing that, and maybe going through something also personally with not having that human contact that they're used to having. So as I said earlier, Zoom fatigue is real, and those that are really need that human connection. So I just want to take a minute and take you guys back to a time when things were just a tad bit simpler. So some of our our next steps is we're hoping to partner with Mental Health of Georgia and bring the mental health first aid training, as well as the outreach wellness learning seminars. We will also begin a series of in-person trainings with small groups in January for stewards of children. With our partnership with LilyPad, we'll have about 10 to 15 participants in a big auditorium, and we'll provide that training at least 3 times throughout the next year to allow multiple people to be trained, even though we have to do it in a small setting. We will also be having a training with Dr. Sarah Vincent with the L'Oreal Psych Group. She will be doing a training called Trauma-Informed Care as it relates to race relations. Title may be changed a little bit, but this will be open to everyone. It will be virtual. It will be a 2-day workshop with each day lasting about 2 hours. One day will be a lecture, and then the next day we'll be working in small groups as in workshop format. The tentative dates for this will be February 11th and February 25th. And then we also have a partnership with Aspire with our Jack and Jill Albany chapter. We will be doing a conference workshop with them titled Pandemic Parenting 2.1. This will be a 4-workshop conference. We're trying to make it as much as a conference, as conference-like as possible, even though it will be virtual. We'll be partnering with Aspire and also some local adolescent psychologists to bring workshops for the parents and providing them resources and information, still giving them the conference bags and that type of thing. This date will be April 24th of next year, and we're excited about that one as well. So just wanted to take the time to say before I end it, I'm just inspired by seeing all the great work that everyone's doing. I know that we are still in our beginning phases, and we're excited for 2021 and for all the change and all the hard work, all the work that it's going to bring. But I just want to say that I'm inspired by everybody. I love the work that everyone has done so far. But at United Way, we are focused on getting everyone to live united. This means being a part of the change, and it takes everyone in the community working together to build a brighter future. That's it. Thank you, everyone.
Thank you, Ashley. And our last grantee presentation is from Thomasville, and we'd like to welcome Elijah Miranda, who's the Executive Director of the Vashti Center, and Alex English is the Community Training Coordinator from the Vashti Center.
Good afternoon, everyone. My name is Elijah Miranda, and like Emily Ann said, Alex English is also on the call as well. I just kind of want to, again, start like everyone else has said, just really thankful for this opportunity to be a part of this project and to kind of be a part of this work. I think for us in kind of Southwest Georgia, for me at Vashti, this really kind of grew from, I guess, an idea or feeling of really wanting to become a more trauma-informed organization here at Vashti. And so we actually did host, this is pre-COVID, kind of early 2019, we hosted a couple of trainings through the Child Welfare Training Collaborative that came down. And what we saw was when we opened those up to the community after some of our staff were trained, is that they immediately filled up. And so that really just kind of shed some light on the need for more training opportunities in Southwest Georgia to get more resources to the rural part of the state. And so kind of the next thing that happened was very fortunate, just introduction by Sonia Vick, who was with the Williams Foundation. She's on this call, and with Emily Ann and with Lynn and with Bonnie. And so it's kind of just started just a great partnership that we're excited to be a part of. What you see on the screen now, this is actually some material that we developed a couple months ago. This is actually where our focus has been on these youth mental health and trauma-informed care trainings. Obviously being able to connect organizations to this resource in Southwest Georgia, we are trying to really get that idea of a universal common language around ACEs and trauma-informed care in this part of the state. So just kind of a look at our pamphlet. You can go to the next slide. And so we've actually, the trainings that we're currently offering are the Child Welfare Training Collaborative, so the 4-part trauma series. And we've worked with higher education, so locally we work with Thomas University. Their seniors in their School of Social Work program this year, because there was not enough opportunities for them to do field work, have been able to participate in these trainings. And so in October, they actually participated in all 4 modules of the CWTC trauma trainings. We've also worked with the Colquitt County School Systems, and that's been a wonderful collaboration there. We're looking to do more of those at the beginning of 2021, as well as continuing to provide these opportunities for Vashti staff as well, new staff as they come in. And then we've also been able to open these up to the community as well. And again, just kind of seeing that engagement. Those are currently being offered virtually, of course. We're also offering youth mental health first aid. We actually do have 2 trainers here on our staff, our clinical director and the director of our Resiliency Clubhouse program. And so we've been able to connect with the local church here, First United Methodist Church here in Thomasville, also focusing on our employees, those that work in our residential program, and then as well as other community members as well. Next slide. And so I was fortunate to go through the Connections Matters training earlier in the summer, and just really thoroughly enjoyed that training and thought it was extremely impactful, and really thankful for Tiffany Sawyer and her team putting this together, and jumped at the opportunity to become a facilitator for this training. Feel that it's so valuable for any organization that's working with children, serving children. And so I became a facilitator and did begin offering these. So I've done 1. I made Vashti employees be the guinea pigs, as I like to say. And so we have another one actually scheduled for this coming Monday, and I'm excited about the group. It's going to be, I think we're going to cap it at around 12 to 13 people, so it's already almost there. And so we're working with a local nonprofit called Hands and Hearts for Horses, Open Door Adoption Agency. Sonia Vick will also be there from the Williams Foundation. And then we have a couple of guidance counselors from the Thomas County School System as well. This is one, again, that we'll be doing more in the new year as well. One of the cool collaborations that we've kind of been able to create is actually with the Adoption and Foster Parent Association of Georgia, so AFPAG, and just like a great, you know, stroke of luck or good kismet or something, but the president, the current sitting president, actually lives in Cairo, which is Grady County. And so it's just been a great collaboration. And so we already have some things lined up in January as well. So at the bottom there, you see we are also offering the Stewards of Children training. So again, the Georgia Center for Child Advocacy, our chaplain, Amanda Messer, has been trained as a facilitator. And so we've worked with a couple of nonprofits, a local dental office as well, a pediatric dental office, and then Vashti staff as well. So next slide, please. Okay. So another part of this project for us down in Southwest Georgia is really trying to share information around ACEs and trauma-informed care, and again, trying to create those that are not necessarily working with children, but have important roles to play in the community, why this is important information to have and why it's so valuable. And so this has kind of been more of an awareness raising section here for us. And so we've been able to go to some civic clubs in Cairo, Rotary Club, Kiwanis Club, and just really, you know, the reception has been great and just really eye-opening for them to kind of share this knowledge. Whenever I go and share, I try to make it as relevant as possible. So I do use local data, and you can see just how important this information is, just how relevant it is. And, you know, if we're trying to reduce stigma, trying to raise awareness, we need to be able to, we're sharing this with communities at large. We've had many conversations with the Thomasville Police Department. Actually, just 2 days ago, there was an article in the paper about the collaboration between Thomasville Police Department and the Vashti Center. And so working with our children to provide opportunities to create positive childhood experiences. And so that's something that we also really value. I think that's one of the greatest takeaways of the Connections Matters training, is how important it is to create those connections, those social relationships. And so we're really thankful for that collaboration with the Thomasville PD. Family connections as well. So Mitchell County and Brooks County we participated in, as well as other surrounding. Thomas County just had theirs last week. And in January, we'll actually be presenting at the Mitchell County Family Connections meeting. There again, I list the AFPAG program, which again, we're really thankful for. It's just kind of been interesting to kind of learn that each county has a foster parent association of some kind. And so working with those foster parent associations locally, you know, I think what the current sitting president shared with me was that foster parents don't necessarily have the tools. And as we all probably would agree on, children that are in the DFAC system, they've all experienced trauma on some level. And so being able to provide resources for these foster parents is something that they find very valuable. And so we're going to try to continue to create this almost like a training curriculum for these foster parents in these local counties here. And we've also been able to work with the local CASA agency here. They're under the umbrella of the organization called Never Lost. They do a lot of great work with foster parents in our area. And so at the CASA volunteer training, we've been able to come in there and provide information around trauma-informed care and ACEs and PCEs as well. So next slide. Okay, so this was kind of barriers and updates. So just an update, I did become a facilitator for the Connections Matters training. We hope that Vashti will be able to add another one whenever the next facilitator training comes out. That second bullet point, we did kind of envision a greater collaboration with the schools. I think the challenge there has been with this condensed school year, the number of professional learning days just aren't there right now. But it's not like they don't want to hear us. I think they've been like, let's see if we can connect early in 2021 and see if we can kind of come up with some strategies. And so I think that we're going to try to be proactive in that approach as the new year is upon us. And then that bottom point really there is ongoing work with the Resiliency Clubhouse. So we are recipient of DBHDD funds, who I know are also on the call, so Layla and Dante. And we're really grateful for this program, and this community is really grateful for this program. And we really have tried to focus more on providing more information and education and awareness raising for the parents of that Resiliency Clubhouse. They're very committed, very engaged with that program. And so in October, we did a discussion on trauma-informed care and ACEs. In November, we did a family night where we engaged with them about information and background, just kind of general information about childhood anxiety. We also gave each of the parents that participated an anxiety wellness kit, so how to alleviate anxiety, and it came with all these neat little tools and just resources. And in December, we're actually having one in a week from today. Yes, a week from today, the 17th, and we're going to be focusing on how parents can be emotional encouragers for their children as well. Next slide. So as far as next steps, I think what we really want to do is continue to increase our training offerings. So Alex English, who is our training coordinator, recently completed a facilitator training for Circles of Safety. That's a child abuse prevention training as well. Trying to figure out ways that we can provide TBRI trainings here locally, collaborating with TBRI facilitators, and as well as the community resiliency model. We want to continue to expand the network of partners. So in some of the counties that we serve, trying to expand that work there, but also more direct work with families and more direct work with parents. We feel like that's really important at this point, that we're able to share this information with parents and provide them with resources and tools as well to help create that kind of common language. And then when it comes to awareness events, just trying to continue plan things in April around Prevent Child Abuse, and also Child Mental Health Awareness Month, which is in May. So we've had discussions about screenings of resilience and working with them and providing opportunities and resources for them as well. So overall, it's just been an incredible experience. I feel so thankful that I get to share the room, the virtual room today with all of you. But again, just thank you for this opportunity.
Thank you, Elijah.
Elijah.
I want to say that this has been a really exciting day. I think we can see that certainly our goal to have trauma-informed care and as a common language and to have teachings throughout the state is happening. Thank you to everyone. I'd like to end today's meeting by calling on Vera Salzburn. She's the program director for Chatham County Safety Net Planning Council. And she will close the meeting for us.
Thank you so much. We would like to finish this meeting with a poem. And Emily kindly asked me to offer this poem that I wrote some time ago. So if you hate poetry, I'm sorry. And it goes like this. If you must be sad, calling your disappointments by their names, lighting a match in your heart's chamber to see the true dimensions of its hollowness, letting the eyes flood, the skin burn, the hands cover, then be. If you must be tired, surrendering to the dark hours of the night, what is left of your perseverance, allowing the pillow to hold your thoughts, the dog to assume your moods, the conditioned air to remain your body's only unconditional lover, then be. If you must be uncertain, retyping unsent messages in the almost finished conversations, retrying unworn garments and asking yourself if they spark joy, not understanding all the languages that are used to discuss the same things, yet waking up each morning, making a cup of coffee and taking another sip of something warm, something familiar, something just for you, then be. Thank you.
Thank you very much. And thanks to everyone on the call today. Have a peaceful and calm and joyful holiday season. Goodbye, everyone. Thanks for being here.
Thank you. Goodbye.